Kinesiology taping for lateral knee pain. Lateral knee pain is an umbrella term for pain at the side of the lateral knee. And there are a few potential diagnoses that may be causing the pain your patient may be experiencing. The first one is iliotibial band syndrome, often known as runner's knee. And that's where there is friction that is occurring between the lateral epicondyle and the iliotibial tract. Other potential diagnoses may be meniscus tears. So when you are assessing and screening your client, check for other symptoms and signs of a meniscus tear, such as popping or the pain is more intermittent. Another one may also be lateral collateral sprain as well. Now, the taping for lateral knee pain may support all of these different potential diagnoses, but it's really important to assess your client before adding tape on. For the purpose of this video, we're going to be focusing on a patient that is experiencing lateral knee pain, potentially due to iliotibial band syndrome. Some potential causes may be some overload or overuse from the repetition of flexion and extension, and you may see this in your clients or patients that are runners or cyclists, and that creates that friction between the lateral epicondyle and the iliotibial tract. There may also be some weakness and muscle imbalance in the abductors of the hip, which is contributing to the pain around the knee. Some treatment considerations. If there is an issue with the iliotibial band, it's important to assess the hip range of motion and strength, and then also rule out any other diagnoses as previously mentioned. There may be some tendon pain or inflammation that needs to be reduced around the knee area, and your patient may be experiencing perceived tightness around any of the muscles surrounding the knee and the hip. For the lateral knee kinesiology taping, we're going to be focusing on just the acute and the early subacute phase. Key points. This taping is a two-step process. The first is a mechanical offload of that tendon towards the patella. And the second is taping for desensitization around that area of pain that your patient has been experiencing. Other options you want to consider: if there is any inflammation present around the knee, then focus on the lymphatic drainage taping to begin with. You may also want to consider some inhibition taping for the iliotibial tract and anterior knee taping, depending on what you have found in your client assessment and examination. Focusing on the lateral part of the knee with the client supine, we take the tape and break off in the center of the paper. And then with the client's bent knee, take a heavy tension of the tape, and the tape is applied inwards towards the patella. Rub the center of where it's been attached, straighten out the leg, and then add both anchors and rub the tape to stick down. For desensitization, the client will let you know where they have been experiencing pain. A smaller amount of tape, break off the paper at the back, and with a light tension of the tape onto a bent knee, apply the tape over the area of pain. Rub the tape down, straighten the leg, stick both anchors down, and rub the rest of the tape to stick the tape down.